Tonight I want to talk to you about your local hospital and whether it will stay open.
Rural hospitals that are already struggling would be forced to shut down.
We can't close rural hospitals. That's my message.
So why is this an issue right now? Well, it's an issue right now because in this big, beautiful bill, as the president calls it, there are massive cuts to Medicaid that will have a huge impact on hospitals around the nation. So it's worth asking, what will be the impact on your hospital? Will your hospital stay open? So let's look at the bill itself and what's in it. There are hundreds of billions of dollars in cuts to the Medicaid program. Now you'll remember that Donald Trump promised he wouldn't cut Medicaid.
And you're not going to feel any of it. And your Medicaid is left alone. It's left the same.
Republicans in the Congress promised they too would not cut Medicaid.
We want to make sure that we hold by our commitment that we are not cutting Medicaid.
And yet this bill drastically cuts Medicaid. Now, why are they cutting Medicaid? Well, they're cutting Medicaid because they want to take the money out of the healthcare system and they want to put that into tax cuts for really wealthy people. In fact, the cuts to healthcare alone in this bill fund fully 1/3 of the tax cuts for rich people in the bill. So they're going after healthcare. Now, not just any healthcare, they're going after healthcare Medicaid that is predominantly for a lot of elderly, a lot of kids, a lot of struggling families. So they're going after healthcare of people who can least afford to lose access to healthcare or government support of healthcare. And what form is that going to take, and why will that affect your hospital? You might say, for example, I'm not on Medicaid. How does this bill affect me? Well, it will affect you in innumerable ways, but let's talk about how it affects your local hospital. Your local hospital, no matter where it is reliant on several sources of funding. It is reliant on funding from Medicare. So anybody who goes to that hospital that's on Medicare, Medicare is one of the payers. It relies on private insurance funding. So someone going to the hospital who's got a private insurance plan, that private insurance plan will defray some of the cost of that hospital visit. It also relies on Medicaid funding because so many people going into that hospital are on Medicaid. Even if you're not on Medicaid, that hospital, your hospital, needs Medicaid funding. And then, of course, there are a category of people going into that hospital who have no coverage at all under any of these programs or private insurance. And there your hospital is going to rely on private philanthropy. So depending on the funding mix of your local hospital, it will either stay open or close as a result of this bill. If, for example, your hospital is in a rural area, or it's in an urban area but a poorer urban area, your hospital is at most risk because your hospital is going to be relying more on Medicaid funding to keep the doors open. Even in the absence of this bill, our hospitals are on a razor's edge. In rural areas in particular, where there's more reliance on things like Medicaid or even Medicare, fully half of those hospitals are really on a razor's edge. At any given moment, about 1/3 of rural hospitals are at risk of closure. In my home state of California, we've seen many rural hospitals close, and we've seen others that closed struggle to reopen. The hospital, for example, in Madera, California, closed about a year or two ago and struggled to reopen. And when it did reopen, it reopened without the labor and delivery unit. And this too is a common phenomenon. That is, your local hospital may be able to stay open, but it may not be able to have labor and delivery anymore, or it may stay open without an emergency room anymore, which means that you will have to go farther in the event of a life-saving emergency than you would without this bill. It is estimated that thousands of people will lose their lives because of the cuts in this bill. That's a pretty sobering fact. Thousands of people lose their lives as a result of this bill. Now, this bill is not a foregone conclusion because a lot of the Republican senators face the worst potential of hospital closures of the senators anywhere in the country. In fact, Tom Tillis, a Republican of North Carolina, reportedly made a presentation to the Republican caucus about the devastating impacts of the Senate bill on his state of North Carolina that would stand to lose about $39 billion in funding for healthcare in North Carolina. In fact, this is the chart he apparently presented in the Senate caucus. And if you took a look at those states, those are red states that are going to be really severely impacted. And so calls to those representatives, calls to your friends in those states to urge them to vote against this, to talk about how painful it will be, to talk about how important it will be to keep your hospital open. Because if they take $900 billion out of Medicaid, as they're trying to do in this bill, that's going to mean a lot of hospital closures, a lot of clinic closures. Let's make sure those hospitals and clinics aren't located anywhere near you or anyone else in the country for that matter. Otherwise, if this bill goes through, we're going to see scenes like this play out in homes across America.
We've recently switched carriers.
We only give assistance to patients without coverage. I'm sorry I can't help you.
Have you tried Medicaid?
No, you don't qualify.
My son is dying. I'm broke. If I don't qualify, who the hell does?